Reaching the age of 70 and beyond is a major milestone, but it also comes with new questions about how to stay healthy. Most seniors are told that regular medical checkups are the key to living longer, and while this is true in many cases, some tests and procedures can actually pose more risks than benefits after a certain age. What many older adults don't realize is that the body becomes more sensitive, slower to recover, and less tolerant of certain medical interventions as the years go by. This doesn't mean you should stop seeing your doctor. Far from it. Regular monitoring is still essential to detect life-threatening diseases early, but it does mean that you should be more selective and thoughtful about which tests you agree to, especially if they are invasive or involve strong medications, sedation, or radiation. Doctors now practice what is called individualized screening for people over 70, meaning they look at your overall health, life expectancy, and personal risk factors before recommending certain tests. The goal is to avoid unnecessary harm, especially when a test might uncover a condition that would never have caused serious problems in your lifetime, leading to stress, expensive treatments, and side effects you didn't really need. Let's dive into 5 medical checkups that may be riskier than you think after 70, starting with 2 of the most common ones. Number 1. Colonoscopy. Colonoscopy is widely used to screen for colon cancer, but after age 70, especially past 75, the risks may outweigh the benefits for many seniors. The procedure requires sedation, which can lead to breathing problems or confusion in older adults. There's also a small but real risk of perforation, a tear in the colon wall, and heavy bleeding. If you've had normal results in the past and no family history of colon cancer, many doctors recommend stopping routine colonoscopies and switching to less invasive stool tests instead. Number 2. Prostate cancer screening PSA test. For men, the PSA prostate-specific antigen blood test can detect prostate cancer early, but after 70, false positives become common. This can lead to unnecessary biopsies, surgeries, or radiation treatments, all of which carry serious side effects like urinary incontinence and sexual dysfunction. In many cases, prostate cancer in older men grows so slowly that it would never have caused harm. That's why medical guidelines often suggest stopping PSA screening after 70, unless there are strong symptoms or a very high personal risk. Number 3. Mammograms after 70. For women, mammograms are considered one of the most important cancer screening tools. But after 70, the story becomes more complicated. While breast cancer is still a risk, mammograms can sometimes do more harm than good at this age. Older breast tissue can look different on X-rays, leading to false alarms. This means you might go through unnecessary biopsies, stressful waiting periods, and even surgery for something that may never have grown or spread. Moreover, some breast cancers detected in seniors are so slow-growing that they would never have caused symptoms during the woman's lifetime. In these cases, treatment might only weaken the immune system, cause fatigue, or increase the risk of other health complications. The decision to continue mammograms should be based on overall health and life expectancy, not just age. If a woman is very healthy and likely to live 10 more years, mammograms might still be worth doing. But if she has multiple chronic illnesses or a limited life expectancy, the risks and stress may outweigh the benefits. Number 4. Bone density scans, DEXA scans. Bone health is very important for seniors because fractures can be life-changing. But bone density scans, usually done every 2 to 3 years, may not always be necessary after 70. These scans expose the patient to low levels of radiation, which is generally safe. But repeated exposure isn't ideal for very frail seniors. More importantly, the treatment options that follow a diagnosis of osteoporosis, like bisphosphonate medications, can cause serious side effects, including jawbone problems, digestive issues, and rare but painful thigh bone fractures. If you've already been diagnosed and are on treatment, you may not need to repeat the scan as often as you did in your 60s. Instead, focus on fall prevention strategies such as balance exercises, vitamin D, calcium-rich diets, and strength training. These steps can protect your bones naturally and lower your risk of fractures without over-relying on medical testing. Being cautious but not fearful. It's important to note that the point isn't to scare seniors away from medical checkups but to encourage smarter decision-making. The key is to weigh the benefit versus risk carefully. Sometimes skipping a test is the healthiest choice you can make, especially if the test leads to unnecessary treatment or puts your body under stress. Number 5. Full-body CT scans and advanced imaging. In recent years, many clinics have started offering full-body scans as a way to detect diseases early. While this might sound reassuring, these scans can expose you to very high levels of radiation, much higher than an X-ray, which may actually increase your risk of cancer over time. For seniors over 70, this becomes a major concern because the immune system is already weaker and the body is more vulnerable to radiation damage. In many cases, these scans pick up small, harmless findings called incidentalomas. These are tiny spots or growths that would never have caused symptoms, but once discovered, they often lead to more tests, biopsies, or even surgeries that may carry significant risks. Doctors now recommend avoiding routine full-body scans unless there is a clear medical reason, such as unexplained pain, internal bleeding, or a suspected tumor. Instead of scanning everything, your doctor can order targeted imaging, like an ultrasound or MRI for the specific area of concern. How to talk to your doctor about risky checkups. After 70, it's more important than ever to advocate for yourself when it comes to medical decisions. Here are a few tips. Number 1. Ask about necessity. Always ask, will this test change the way we manage my health? If the answer is no, the test might not be needed. Number 2. Understand the risks. Request a clear explanation of potential side effects, false positives, and what might happen if you don't do the test. Number 3. Consider quality of life. at this age. Your comfort and daily function may be more valuable than aggressive screening for diseases that might never harm you. Number 4. Bring a companion, having a spouse, adult child, or caregiver at appointments can help you remember details and ask good follow-up questions. Medical checkups are an essential part of healthy aging, but after 70, you have to be more careful about which ones you choose. Colonoscopies, PSA tests, mammograms, frequent bone scans, and whole-body imaging all have their place, but they should be approached thoughtfully. The goal is not just to live longer, but to live better, with as little unnecessary pain, stress, or risk as possible. Being informed, asking questions, and working closely with your health care provider can help you strike the right balance. When you focus on tests that truly improve your health outcomes and skip the ones that only create worry, you protect both your body and your peace of mind. Key takeaway: after 70, smart screening is about quality over quantity. Choose checkups that truly help you stay healthy. And don't be afraid to say no to tests that may do more harm than good.